Women are commonly told by their mother, by their sister, by their best friend, and even by their doctor that hormones are going to cause cancer. That came from a study that was stopped in 2002 called the WHI, or the Women's Health Initiative. That study was looking at a particular product, Premarin and Provera, and how these women responded to that product and what were their risks of taking that product. In that particular study, they saw an increased risk of breast cancer, heart attacks, strokes, and even early dementia. And so that's why all hormones are labeled with those particular risks when you go pick them up at the pharmacy. What we've learned in the last 20 years is that study had some flaws. The women were much older in that study, and they were not as healthy as the average menopause woman. And in that time, we've learned that women who are symptomatic from their menopause can safely take hormone therapy for many, many years, and they can actually lower their risk for type 2 diabetes, osteoporosis, and cardiovascular disease.